Welcome to Lesson 1 of the ACE-CPT exam prep series. This is Chapter 1 of 18, and it falls under the domain of risk management, professional conduct, and ethical business practices. Today, we're talking about the role and scope of practice for a personal trainer. By the end of this lesson, you'll know exactly what falls inside your job as a trainer, what falls outside it, and how to build a referral network for everything that falls outside. This matters more than most new trainers realize, because knowing where your job ends is just as important as knowing how to coach a squat. Let's start with what you'll walk away with from this lesson. There are 4 learning objectives. First, you'll be able to define a personal trainer's scope of practice. Second, you'll be able to identify activities that fall outside that scope. Third, you'll learn to list the key referral sources and when to use each one. And fourth, you'll understand why scope of practice ties directly into something called the standard of care. Keep these 4 in mind as we go. They're the backbone of everything in this lesson. So let's zoom out for a second and look at the big picture. There are really 3 pieces to this puzzle. Number 1, inside scope. This covers exercise programming, risk screening, fitness assessment, and behavior coaching. This is your core job. Number 2, outside scope. This includes diagnosing conditions, prescribing treatment or diets, treating injury or disease, and clinical counseling. These are not your job, even if a client asks for them. And number 3, the referral network. This is your list of rehab, nutrition, medical, and mental health professionals, the people you call on the moment something crosses that line. Hold on to this framework: inside, outside, and referral, because we're about to break down each piece. Let's dig into what's actually inside your scope of practice. A certified personal trainer works with clients who are apparently healthy, or who have documented medical clearance to exercise. Within that population, your job includes 4 core activities: conducting health history interviews and stratifying risk, administering fitness assessments, designing and delivering exercise programs, and coaching behavior change and adherence. That's the full picture of what you're trained and certified to do. Everything else needs to go through someone with a different credential. Now let's flip it around and look at what's outside your scope, because this is where trainers get into trouble if they're not careful. First, diagnosing. Naming or confirming a medical condition or injury is a licensed clinician's job, not yours. Second, prescribing treatment, diets, or supplements. Individualized medical diets belong with a registered dietitian or a physician. Third, treating injury or disease. Rehabilitating an existing injury is physical therapy, not personal training. And fourth, clinical counseling. Supporting a client's motivation is absolutely in scope, but treating a diagnosed mental health condition is not. Notice the pattern here. Each of these requires a credential you don't hold as a personal trainer. So what do you do when a request falls outside your scope? You refer out. That means building a referral network before you actually need one. For rehabilitation professionals, think existing injury, unresolved pain, or post-surgical clients. For nutrition professionals, like registered dietitians, think requests for individualized or medically driven diets. For physicians or nurse practitioners, think uncontrolled symptoms or when medical clearance is unclear. And for mental health professionals, think signs of a diagnosable condition that goes beyond general support and motivation. Build these relationships now, before a client is sitting in front of you needing one. Here's why all of this actually matters in the real world. Operating outside your scope of practice is where most of a trainer's real liability risk lives. Staying inside scope, documenting your health screenings, and referring out promptly, these are the basics of something called the standard of care, the level of caution a reasonably competent trainer would exercise in the same situation. And here's the key mindset to take with you. When in doubt, refer out. A confident guess about pain, diet, or mental state is still just a guess, and it's a guess outside your training. Let's make this concrete with a real scenario you might actually face. A client asks you for, quote, just some stretches because they've had 2 weeks of sharp back pain. That sounds harmless, but that's actually a treatment request in disguise. So what do? You redirect. You don't just refuse and leave them hanging. Something like this. I don't want to guess at what's causing that. Let's get you seen by someone who can actually diagnose it, and I'll work around whatever they recommend. That's the scope of practice mindset in action. Helpful, but honest about where your expertise ends. Let's test what you've learned with a practice question. Which of these is inside a personal trainer's scope of practice? Option 1, diagnosing a rotator cuff tear. Option 2, prescribing a medically driven diet. Option 3, conducting a health history interview and stratifying exercise risk. Option 4, treating a diagnosed anxiety disorder. Take a moment to think it through. The correct answer is option 3. Health history intake and risk stratification are core scope of practice activities. Everything else on that list belongs to a different credential. Here's your second practice question. A client asks for a specific meal plan to manage diagnosed diabetes. What should a trainer do? Option 1, design a low-carb meal plan. Option 2, refer to a registered dietitian or physician. Option 3, ignore the request. Option 4, recommend a supplement. Think it through for a moment. The correct answer is option 2, refer to a registered dietitian or physician. Medically driven diet plans fall outside your scope, and they belong with someone who's licensed to manage that condition. Let's wrap up with the key takeaways from this lesson. A trainer's scope covers exercise programming, risk screening, fitness assessment, and behavior coaching. Diagnosing, prescribing treatment or diets, treating injury or disease, and clinical counseling all fall outside scope. A referral network is a core professional responsibility, not a last resort you scramble to build when you need it. Staying inside scope and referring out promptly are the basics of standard of care. And here's a simple test for any borderline request. If the answer changes based on a credential you don't hold, it's outside your scope. Keep that test in your back pocket. It'll serve you well, both on the exam and in your career. That wraps up Lesson 1. In Lesson 2, we're moving into the principles of adherence and motivation. We'll cover self-efficacy, the difference between intrinsic and extrinsic motivation, and what actually drives a client to stick with their program long-term. See you in the next lesson.